and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife, and one of the MCs here at Gold. And here at Gold, we are getting ready for our tongue tie conference, our very first tongue tie conference. Yes, we always had our tongue tie symposiums in the past, but this year we have a full conference planned, and we have a fantastic add-on package for you as well. And with me here today is It's Jacklynn Knotts. Welcome, Jacklynn. It's good to have you here today.
Hi, thank you so much for having me. Super excited.
Oh, so fantastic to have you here. You are part of the add-on package, and your presentation is titled Therapeutic Consideration of Care Plans for Tethered Oral Tissues and Frenotomy During the NICU Stay. Woof, that's a big topic, NICU. And talking about frenotomy and tethered oral tissue is a big enough topic in itself, but then we're talking during the NICU stay. I can't wait to find out more. But before we jump into that, first, I want to know a little bit about you, Jacklynn. Tell us about your professional background here.
I actually have been working in the NICU for going on 9 years now. I have been in OT for a little over 10 years now. And so my passion for the NICU really developed when I was in school. I was able to attend and do my level 2 field work in a level 4 NICU in San Antonio. And so that really sparked my passion for this population. And I knew when I was there, I was like, this is what I want to do. But what further amplified that passion was when I had my firstborn a couple of years later, and we experienced our own NICU stay.
Mm-hmm.
With feeding difficulties and just prematurity. And, that just kind of really just made me go full force into, I want to get into a NICU. There's so much that we can do. And, my biggest goal has kind of always been, especially around feeding, is I never wanted another mom to feel the way that I felt when I was in the NICU. And so that's kind of always just been my passion of being sure that I'm helping to support moms and dads with their feeding journeys in the NICU.
And
So
your passion really shows through. I can see really that spark in your eyes when you talk about that, because as you mentioned, you've experienced it yourself, and you don't want other parents to feel like that, right? So it is such an important topic. Now, tell me a little bit about tethered oral tissue, and what are we looking at here with these little tiny babies that are either premature or have any other health concerns? That's why they are in the NICU. What are we looking at here? Tell me a little bit about how you diagnose or looking at this, and what is different in the NICU, which I can assume is much more complex than if it was a full-term infant.
exactly. So the biggest thing that when we're talking about infants in the NICU, I think that a lot of people can probably understand is that I think tethered oral tissues in the NICU don't always mix. And especially from what I've heard from different people that I've talked to and spoken with who work in the hospital systems, there's even some hospital systems who are very much like, we don't want to talk about this. Like if it's a tongue tie. So I think it's really important that it is something that we're considering. And I'm super blessed to work in a place where it's not just like mum's the word, because we do have a lot of infants who are experiencing difficulty feeding within the NICU. And a lot of the times it is related to, the reason as to why they're there, whether it's prematurity or respiratory distress or chromosomal anomalies or congenital anomalies. Like that's all expected, but sometimes there are infants that we have seen personally where, we're kind of getting through all of those things and weeding through whether or not it's related to respiratory or prematurity or, all the other things. And we're still just not seeing these babies progress. And these babies are at risk at home, either when a lot of the times babies are going home and just not breastfeeding, because mothers gave that up, and maybe they're using the bottle and they're doing okay with that. But even then, there are some infants where not only have mothers given up breastfeeding, but then now they're still having a lot of difficulty with the bottle, and they may be at risk of going home with a G-tube, right? And so it's something that I think is really important to consider, especially when we're at that point, just to kind of see, are we really digging through and getting rid of every barrier that could be there for an infant who's in the NICU?
Sounds wonderful, and I'm glad to hear that you're in a facility where, that is being considered, and there's openness for that. Because you are so right. I mean, looking back, even just a few years ago, breastfeeding in the NICU itself was already something that was like, oh, we want these little ones to get fed no matter how, and so there is a shift happening, and I feel like. And correct me if I'm wrong, but do you feel like there might be a shift happening in with regards to tethered oral tissue as well? That it just takes a little time. That more and more hospitals or facilities are more open to considering this, looking into this, having therapeutic interventions and such. Or do you think your facility is an anomaly?
I mean, I don't know. I really hope so. I hope that we're not the only ones. But I definitely see that, agree with there's a shift regarding feeding. And I mean, I've seen that,
Mhm.
since the time when I arrived and I was with my infant, and we were, kind of subjected to some of those forceful feedings, at the bottom,
Mhm.
lots of difficulty with breastfeeding, kind of just the push to get the volume in. Even so much that even me as a mom was kind of like, I just have to do this so that we can break out of baby jail?
Yeah,
Uh,
yeah, yeah. Mhm.
the, but no, I'm hoping that there's consideration of tethered oral tissues, because I think it's a really, really important thing. I think it's very scary when we think about it in the NICU, especially because there is so much inconsistency in what that actually looks like and how, one truly diagnoses, is this a tethered oral tissue or is it not, based on anatomy? And I think it's really important that we're looking at function, and that's what we're doing in our
Mhm.
hospital. And I just want to say, like, I don't personally diagnose, but I do
Right.
discuss what the functional patterns are, and we discuss with an appropriate provider who can diagnose. But
Who
there
can
is a
that?
lot of teamwork in that, and that's really great. So I'm really hopeful that this is something that people can consider, so that even if we're not doing releases per se in the NICU, but that we are being allowed to provide that education to parents so that they can
Mhm.
empower themselves, so that they know where to go after discharge.
So if I understand this right, and I know you'll talk about this, in detail in your presentation. So releases in the NICU are not very common, as I assume, right? Correct?
I think that they are, no, I don't believe.
Yes. Right. But there are other therapeutic interventions, non-surgical interventions that you will be talk about in your presentation. So just give me a little overview. What is meant by that?
So what's meant by that is basically, there are certain things that we can do to kind of help with our infants, right? So I think when it comes to the NICU population, we can expect that a baby may or may not feed well, and maybe they have a tie. So one thing that kind of pops to the top of my head is, if we have an infant who doesn't have great range of motion with that tongue because they have some limited elevation due to restriction or anything like that. One thing that I've kind of mentioned to some of the nurses within our unit, and my fellow therapists that I work with have also kind of mentioned this to them as well, as if they can't bring their tongue to the nipple, we're going to bring that nipple to their tongue, right? And so
Mhm.
we're going to adapt it in a way. And usually the way we do that is by looking for a nipple shape that may help to, give them that connection
Mhm.
that they need, so that they can have that suction that they need and that seal that they create. And we also do this. I think old practice, or we're kind of moving away from this, is you used to see that when they couldn't maintain that suction, we used to do chin and cheek support, right?
Right.
Well,
Hmm.
as we've learned and as we've grown, we've seen that chin and cheek support can be really detrimental, especially if the baby's using these strategies to kind of help purposefully come away from the flow. So by not providing chin and cheek support, and by bringing the bottle to, or the nipple to, the infant, we're allowing this infant more autonomy so that they can choose what they do next, while still also supporting, their limited range of motion. So that's kind of one of the adaptations that we'll sometimes use.
Oh, fantastic! I like that, the autonomy for the infant, and moving away just from the chin and cheek support. There sounds absolutely fabulous. Let me ask you a little bit about research. I know in recent years there is more research available about tethered oral tissue, but not necessarily in the NICU. So, what have you seen? Was it difficult to find research on the topic? Was there some? What is the state of that?
It was, and this wasn't just something that I looked into for the presentation as I was creating it, but it was also something that, we looked into when discussing with our providers within our NICU about, what's out there, what are other people doing, how are they approaching this? Because of course, with that first infant that we came, we're like, well, we think maybe this
Mhm.
baby from it. That conversation did come up, and it is, I've looked, and there's really like no research that I could find that discusses tethered oral tissues in the NICU. There was one guideline that I found from the United Kingdom that did discuss kind of a guideline for clinical reasoning to, what you should look for with breast and bottle feeding infants before you make a referral. And it
Mhm.
seems like they did do releases in the house. It wasn't entirely clear, but that was the one thing that I kind of found closest to the NICU, to the hospital system, because it did also mention in there, if they go to the NICU, you want to look at these few things, but it didn't have a full, explanation of all the things that should be considered.
So there is definitely a need for research, and maybe anyone who's listening now or watching now and is in the field of might be, interested in, yes, we need more research, and maybe contributing there or starting a research project as well. That would be fantastic, right?
For sure. And I'd like to say too that I think as well, like, even for us that have done frenotomies in the NICU,
Hmm.
it's few and far between, right? It's
Right.
not,
Yes.
and I think that's important to state, just because there is really a push to be sure that we're helping to be sure that we're addressing every other concern. We're not racing to do this with all of our
Right.
infants, especially the
Yeah.
most fragile population. So for the infants that we have done it with, it has always been a team effort. We have utilized pediatric dentists as well,
Mm.
and we've seen some good success, but I can say we can probably count on one hand how many babies we've
How many
actually done.
babies? Yes. Well, thank you for clarifying that. It was very interesting. Jacqueline, it was so nice having you here today. Before I let you go, any final words to our viewers, what you hope that they will taking away from your presentation?
I hope that viewers just take away from this that, even if this is not something that's happening within their unit, it's not something we should completely just write off. There are things that we can do to kind of help prepare this family during and throughout their NICU stay to help, promote that optimal function, as well as prepare them for a release that they may receive after discharge. And so just really hoping to help providers, think in a different way so that we can empower parents, and hopefully also open up the conversation within the units so that it is something that's talked about.
Jacqueline Notts, thank you so much for being here today. I'm looking forward to your presentation very much.
Thank you so much. I appreciate it.
And now some information for our viewers. If you would like to find out more about this presentation, as well as the other presentation in the lecture pack that's titled Navigating Challenges in the Care of Tongue-Tied Babies, please go to goldtonguetied.com. You find information about the entire conference and also this wonderful add-on package. And I hope to see everyone at the conference. Bye-bye, everyone.